Hello everyone. Today we discuss about fatty liver. Its symptom, its causes, and what is fatty liver. Okay, now we start. Fatty liver refers to the deposition of excess triglyceride in the liver cell. The normal concentration of lipids in liver is around 5%. Liver is not storage organ for fat. In the normal liver, Kupffer cell contain lipids in the form of droplets. In fatty liver, droplets of triglyceride are found in the entire cytoplasm of hepatic cell, causes impairment in metabolic function of liver. Fatty liver is associated with fibrotic changes and cirrhosis. Causes of fat deposition in liver. Mobilization of NFA from adipose tissue, excess synthesis of fatty acid from glucose. Removal of fat from liver, toxic injury to liver, secretion of VLDL needs synthesis of ApoB100 and ApoC. Decrease oxidation of fat by hepatic cell. The capacity of liver to take up the fatty acid from blood exceeds its capacity for excretion as VLDL. This leads to the overproduction of triglyceride and their accumulation in liver. Fatty liver can occur in diabetes mellitus and starvation due to increased lipolysis in adipose tissue. Alcoholism and high-fat diet are associated with increased mobilization of fatty acid and cause fatty liver. Alcohol also inhibits fatty acid oxidation, promotes fat synthesis and its deposition. Excess calorie intake, excess calorie, either carbohydrate or as fats, are deposited as fat. Obesity may be accompanied by fatty liver. Very low density lipids formation require phospholipids and apoprotein B. Impaired lipoprotein synthesis may be due to defect in phospholipid synthesis, a block in apoprotein formation, a failure in the formation of secretion of lipoprotein. Dietary deficiency of lipotrophic factors such as choline, betaine, inositol, etc. Deficiency of essential fatty acid leads to a decreased formation of phospholipid. Lipoprotein synthesis and their secretion require ATP. Decrease in the availability of ATP, pyridoxine and pantothenic acid deficiency also impair lipoprotein formation. Deficiency of vitamin E is associated with fatty liver. Selenium acts as a protective in nature. Certain hormones like ACTH, insulin, thyroid hormone, adrenocorticoids promote deposition of fat in liver. Non-alcoholic fatty liver disease is the most common liver disease where fat is accumulated in hepatocyte. High-fat diet, uncontrolled diabetes mellitus are the most common cause. As the disease progresses, inflammatory reaction occur, which is termed as NSH. Fat molecule infiltrate the cytoplasm of the cell. Fatty infiltration. This is seen as fat droplet in the cytoplasm. The nucleus is pushed to a side of cell. Ultimately, the hepatic cell is lysed as a healing process, fibrotic tissue is laid down, causing fibrosis of liver or cirrhosis. These are the substances required for the normal mobilization of fat from liver. The deficiency of these factors may result in fatty liver. Important lipoprotein factor: choline, betaine, methionine, inositol, folic acid, vitamin B12, lysine, serine also serve as lipotropic factor. Choline, inositol are components of phospholipids and required for their synthesis. Other lipotropic factors are concerned with transmethylation reaction and ultimately the synthesis of choline. Severe protein deficiency kwashiorkor causes fatty liver due to a defect in the synthesis of choline as a result of insufficient amino acid methionine supply. Vitamin E and selenium give protection due to their antioxidant effect. Omega-3 fatty acids have a protective effect against fatty liver. Decreased phospholipid synthesis, impaired formation of lipoprotein membrane, reduced synthesis of carnitine due to insufficient supply of methyl group, impairment in fatty acid oxidation. These are the causes of fatty liver. Now, what are the symptoms of fatty liver disease? People with fatty liver disease often have no symptom until the disease progress to cirrhosis of the liver. If you do have symptom, they may include abdominal pain or a feeling of fullness in the upper right side of the abdomen, nausea, loss of appetite or weight loss, yellowish skin and whites of the eyes, jaundice, swollen abdomen and leg edema, extreme tiredness or mental confusion, weakness. Because fatty liver disease often has no symptom. How is fatty liver diagnosed? Because fatty liver disease often has no symptom, your doctor may be the first one to spot it. Higher level of liver enzyme, elevated liver enzyme that turn up on a blood test for other condition may raise a red flag. Elevated liver enzyme are a sign your liver is injured. To make a diagnosis, your doctor may order ultrasound or CT scan, computed tomography to get a picture of the liver. Liver biopsy, tissue sample to determine how far advanced liver disease has progressed. Fibroscan, especially as ultrasound sometimes used instead of a liver biopsy to find out the amount of fat and scar tissue in the liver. This is the causes and diagnosis and symptoms of the liver. The treatment of the fatty liver we will discuss in next video. Thank you.